I'm Dr. Karen Gordon Boyle, Deputy Chief Medical Officer, and welcome to today's COVID-19 update. Now for the global statistics. According to the World Health Organization, the total number of cases is 10,533,779, with 512,842 deaths. In the region of the Americas, the number of cases is 5,317,792, with 252,340 deaths. I will now bring you the update for the situation in Guyana. As of July 3rd, 2020, of the 43 tests done, there have been 6 new cases, bringing our total number of positive cases to 256. 117 persons have recovered, but we have recorded yet another COVID-19 death, bringing the total number to 14. In institutional isolation, we currently have 125 active cases, 16 persons in institutional quarantine, and 1 person in the COVID ICU. To date, we have tested 2,711 persons, with 2,455 being negative. Fellow Guyanese, the new COVID-19 death has occurred in Region 7, in a family where the spouse and the children are now left without a father, the breadwinner, the one in whom the family looked for comfort and protection. I am pleading with you, therefore, to consider your actions and envisage that life could change in a wink. Avoid the COVID-19 trauma and cooperate fully with the Compliance Division of the Ministry of Natural Resources, the Civil Defense Commission, the Army, and the police, who will be working collaboratively with the Ministry of Public Health to contain the spread of this fatal disease in your communities. I wish to provide you with another excerpt of Natalie's story, whom you will recall is a COVID-19 patient. There were only 4 beds in my bay, and everyone in there had tested positive for COVID-19 and had an underlying health issue. 2 other women already in there were diabetic, and a 3rd woman was brought in opposite me after a couple of days. I don't remember much of the first few days, just nurses coming in and out all the time. Most of the noise was from me ringing the bell and gasping for drinks of water. I was so weak, it's all I could manage to say, that commode. That was when I started hallucinating. I was getting flashbacks of conversations I'd had in my life and people I'd met. At one point I thought, am I alive or dead? Do these flashbacks mean I'm transitioning to death? Is this what people mean when they talk about your life passing before you when you die? And then I'm saying, no, I don't think actually I'm dead, because there's no white light and no angels and nobody calling me. Then all of a sudden I heard a male nurse outside the door say, she's gone. The poor woman opposite me had died. Then I heard them put her in a body bag, zip it up and say, on the count of 3, 1, 2, 3. The noise of that body coming into contact with a metal trolley, that's a sound you don't forget. The day before, I'd been looking at somebody and now the bed was empty. That thought really affected me. I started watching the woman in the bed diagonal to me. She slipped into a coma, and I watched her daughter come and say desperately, "Mom, it's me. Mom, it's me." And it was pitiful because the woman was already gone. I had fought to stay alive. After being almost ready to give up at the start, I had told myself, no, I've got to carry on. I'm not going yet. I'm 49. I'm not ready to die. Not just for me, but for my kids and my family and friends, my sister Lorraine, my brother Richard, had texted me constantly with love and support that gave me the will to fight it. The same day, they tested my blood oxygen saturation levels, and I scraped by. The doctor said, "You've just made it. I'm happy to discharge you." I was so excited I was going home. I'm bedbound for the next few weeks, and the doctor said it could take 3 to 6 months to get over the pneumonia. I touched death, and I'm very lucky to be alive. What I'm now looking forward to is appreciating nature. You realize material things don't matter. I've been given a second chance. Do you still believe that COVID-19 is imaginary? That you cannot contract this disease, and that if you are infected, you can easily recover and move on with your life? The aftermath of COVID, my fellow Guyanese, is even more unpredictable. You can suffer brain damage, paralysis, irreversible lung damage, as the headline of this article reveals. Woman in her 20s receives double lung transplant after suffering irreversible damage from COVID-19. On your screen, you will see 2 images. Above is the damaged lung after COVID-19. Below, side by side, is an X-ray of a healthy lung and the damaged lung. One X-ray, oxygenated, and both lungs filled with air. The second lung shows the damaged lung, with the right side showing poor air entry and collapsed air sacs. Note well, she had a healthy lung before COVID. My fellow Guyanese, the choice is yours. Have a great and safe weekend. Do your part. Respect the curfew, wear a mask, practice physical distancing, and only venture out if necessary. Home is the safest haven. Thank you.